Hello, my name is Jamie Prosize, and I am so excited to see all of you guys' presentations and to actually see some faces of the classmates that we've had discussion boards and everything with throughout not only this class, but some names looked familiar that I've had in classes before. And so it's just exciting to, like I said, to see all you guys' faces and see what you guys did in your community presentation and with your clinical. My clinical was at the Orthopedic Center in Mount Vernon, Illinois. I was with Amanda McKee. She is a family nurse practitioner who specializes in bone density testing for osteoporosis. Most of the patients that Amanda sees, actually all of the patients that Amanda sees, are post-op patients from either hip surgeries, any type of bone fracture surgery, knee replacement, hip replacement, back surgeries. She doesn't just deal with osteoporosis. She deals with all of the surgeons, all of their post-op care primarily. And at the Orthopedic Center, they have such a good work environment, and I never really fully understood what a nurse practitioner did and how they could prescribe medications, how they could give injections, and all that stuff for the physicians. And I was actually speaking with Paula about this it was like actually right after my first clinical. I was maybe kind of dreading it a little bit because that's your day off from work or, taking the extra time, but that's what we're doing here is taking the extra time in our bachelor's program to further our education. But like I said, one of the things I did not realize what the nurse practitioners do. And in a way, I feel that this clinical has helped me to maybe after a little break or so go on for my master's. And I'm not sure if it's going to be nurse practitioner or if it's going to be for teaching or, what it's going to be. But this clinical was definitely a push in the right direction for me. So I hope you guys had as much of a good experience as I did in this clinical setting because it was a very eye-opening experience. I work in a pre-op unit, pre-op surgical unit, and I also work recovery. So it was also, I think, very important for me to see the post-op side, not necessarily the post-op side. I see the post-op side up on the floor, almost on a daily basis. And I used to work on a surgical oncology unit, so we usually received all of the post-operative hip replacements, the spine cases, knee replacements, anything ortho-wise. But it was just very interesting to see how the patients do after the hospital stay. And it was really cool because the Orthopedic Center is right down the road, like the same drive from the same literal driveway to the hospital. So it was cool because I got to see one of the spine cases, a lumbar spine, post-operatively. And I had this patient in pre-op and I had her in recovery, and I actually got to see her at the Orthopedic Center with Amanda. And she had a cervical spine fusion actually, and those cases are very difficult for patients after, not even after surgery, not initially right after surgery, but those 2 weeks, it's rough. They can't, because the cervical is right here. They can't even hardly swallow, eat. They're eating mashed food, pureed foods, and she felt rough. She looked rough, but it was also, I was able to see her at 4 weeks and 6 weeks out, and she was like a total different person. that 6-week out. So for my topic, I chose osteoporosis. Amanda helped me see how big of a need education is for this, and just the line of testing that can be done, non-invasive, and that most of all insurance deal with. And one of the main way of diagnosing osteoporosis is through a DEXA scan, and I got to sit and watch a lot of the DEXA scans. I will show you here. This is what a DEXA scan lays out for the healthcare professionals, such as Amanda. The DEXA scan measures the bone density in the spine and the neck of the hip. And it throws out numbers, T-scores and Z-scores, that places a patient at normal bone density and at like osteopenia, and then also diagnoses them as osteoporosis. And here you can see the lumbar 1 all the way through to the lumbar 4. The L1 through L4 is what they measure for this. And like I said, they also have to get a number from the neck of the hip as well. Most of the time in elderly, I mentioned this in the community presentation, but I haven't done a study on this, and I haven't read about a study on this, but I would guess in my line of work, I see 80% of elderly patients that have a fracture right here in this neck of the hip, where they have to go in and do an IM nailing, and it is an emergency case in most times. The description of my group was around 18 of adults 65 and older. Most were women. I think there were 16 women and 2 men. It was a senior citizen luncheon at one of the churches around here, and they were very receptive with what I said. I did give them an evaluation at the very end to evaluate me and, tell me what I could do better, tell me what they liked, and all of that about the presentation. Some of the slides that I had, this first slide was one of the first ones in my presentation, and it was just talking about how and why osteoporosis is labeled as the silent disease. I wanted to state to them that bone loss occurs without symptoms. You don't feel your bones getting osteoporotic or getting more dense. The first sign for some people might be that fracture in the elderly patient in that neck of the hip. That might be their first sign. And Amanda stresses to all of her patients that a sudden strain, twist, cough, or bump can break a bone. And it is true. I mean, how many times have we had a patient come in the hospital and say, I don't know why I fell. All my rugs were picked up. That's one of the main things you want to tell the elderly and the aging population is to pick up all those rugs. Rugs are great, but they're a huge tripping hazard. So, but like I said, a sudden twist, strain, cough, or even a bump can break a bone. And that's why some of these patients don't even realize why they've fallen. It's because they've done a twist or a sudden movement that has caused that neck of the hip to become fractured. In my evaluations, a lot of the audience put that they they liked to see the frightening statistics that I had. And I got most of my references from the Healthy People 2020, World Health Organization, and the National Foundation for Osteoporosis. That those are the top three references that Amanda always gives to her clients as well. And she helped me with some of the research for this to get a good education out to the population that I was talking to. So for some frightening statistics, Healthy People 2020 said that the major health threat for an estimated, that osteoporosis is a major health threat for an estimated 5.3 Americans 50 years and older, and that by 2020, half of the Americans over the age of 50 are expected to have osteoporosis. And like I said, without the education and teaching to the general population, they're not going to know until they've had that fracture that they have osteoporosis. And like I said, we have to get the word out there that women 65 and older, insurances pay for a DEXA scan. And in all honesty, Amanda would always talk about, a DEXA scan is $100 at the office if somebody would not have insurance. And I spoke to this on my community presentation too, is, $100 might be a lot to someone, but what's the cost of a hospital stay? It's going to be a lot more than $100. So also 1 in 2 women and 1 in 4 men over 50 will have osteoporotic related fracture. And 1 in 4 people with a hip fracture die within the first year, and 1 in 3 will end up in a long-term facility. So that last one is a huge eye-opener, especially, for people who haven't had a family member in the hospital or have a broken. They don't realize how people can go downhill so fast after a fracture. Some of the other comments that I got on my evaluation, which I will show you what I asked in my evaluation a little bit later, is some risk factors. They enjoyed seeing different medications that can cause the osteoporosis and just the general risk factors. So here is another slide of the risk factors that I put. For women, they are automatically at risk after 50 and older. Men, they're not out of the woods. They're still at risk at 70 or older. And as you can see, menopausal women, anybody with a previous fracture is at immediate risk as well. Some of the medications are Dilantin. The cancer and chemotherapy agents are horrible on bones. Steroids and thyroid medications such as Synthroid, which Synthroid there are quite a few, it seems, that are on intaking Synthroid. And then excessive intake of sodium, protein, and caffeine. And I also mentioned in my presentation, look at our diet. Our diet is all, it's so much fast food. Fast food is that sodium, the protein, and the caffeine. It's horrible, and we've got to start doing better education on what the diet alone can do to our bodies. I also talked about exercise. Exercise is, they expect 30 minutes of exercise 5 days a week that can help out your bones. High impact weight bearing, if you're able, aerobics, hiking, jogging, tennis, or dancing. Low impact weight bearing, such as elliptical, stair step, or walking. Muscle strengthening, and non-impact weight bearing, which is working on balance and posture. Amanda did talk a lot about like going to a yoga class or something like that, just to work on their balance is the big thing, because if you're not lightheaded, but if you're jug-headed, I guess, as my grandma would say, sometimes your balance isn't the best. So you got to work on that to try to reduce those fractures. One of the last slides was just a statement from the National Health Service, and I thought that it was very clear. It states that your genes are responsible for determining your height and the strength of your skeleton, but your lifestyle factors such as diet, exercise, influence how healthy your bones really are. So you can't really blame your genes for this one. You need to they need to take advantage of their of the doctors around and the facilities around that help with the osteoporosis and screening. One of the handouts, another thing on my evaluation that I gave to my audience, Amanda let me have some bone models of normal bone and then an osteoporotic bone. This right here I was able to pass out, and it is the sample of what a normal bone should look like. And you can see it is completely full, hardly any spacing. And then this one over here, you can tell this is a major osteoporotic bone. And it is a perfect example of how a bump, twist, or even strain can make a fracture. I mean, it's almost twisted already. And just imagine the neck of the hip right here, where most of the fractures usually occur. I gave 2 handouts to the community, or my audience in the community presentation to take home, and a lot of them commented about this. It's from the National Osteoporosis Foundation, and it's 25 ways to improve your bone health. As you can see, it talks about getting enough calcium and vitamin D every day, and do weight-bearing exercises, keep healthy lifestyles, and just talk to the doctor about bone health. Some doctors, just need a little bit of a push for the osteoporosis prevention and screening, and just ways to improve your balance and prevent falls. That is one thing I learned doing this, is how big the balance can actually help. And then I gave them a copy of 25 calcium-rich foods that they can take home, and how many ounces and how many milligrams of calcium is in each one. And like I said, both of these were from the National Osteoporosis Foundation. Last but not least, this was the evaluation that I gave to my audience to fill out, just how my presentation was if it was interesting and relevant, if the concepts presented were communicated clearly, if they enjoyed the handouts given, and then I had what was their favorite part about the presentation, and what, if anything, would they change. And I was really honest with them. I wanted them to tell me, what they would change about the presentation. I think all of them were too nice, and they didn't give me any negative feedback about the presentation. Most of the positive comments that I received were the handouts given, the frightening statistics, the medications, and they really enjoyed seeing the examples of the normal bone and then the osteoporotic bone. And to sum it up, I just wanted to say that this community presentation and the clinical was the highlight of this class for me. I really enjoyed going out and visiting with the community, seeing what a nurse practitioner does, and just working with the surgeons and the nursing staff there at the orthopedic center. It was a great experience, and I hope that you guys enjoyed your clinical experience as much as I did. Thank you.